Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Stringent travel restrictions, tracing the journey of migrant workers within the state and quarantining them as required, to launching a two-tier COVID helpline and mobile app to address public health grievances, the Bangalore Municipality Corporation's efforts to contain the viral outbreak in the city have been described as almost overzealous. But it has certainly paid off, as the numbers were as low as 149 active cases in the first week of June 2020. I spoke to Dr. George D'Souza, who is the Dean of St. John's Medical College, about how private institutions in the city are working in collaboration with the government to tackle the spread of coronavirus. This is what he had to say.
So, first thing is, I think maybe the government got the timing right of stopping flights coming into the city, of stopping traffic, both rail and road coming into the city. So probably that timing was right. So you didn't have fresh cases coming into the city. Then wherever, or even like you said, in the whole state of Karnataka, they identified spots and they locked those areas down more than, I mean, there was a lockdown across the state, but those areas they restricted movement to a bigger extent. They tracked all the contacts. They quarantined them, and among them who were positive, they isolated them into the hospital so that infection would not continue. So I think they did that well. And from the very beginning that they've used the whole healthcare workforce to help in that exercise. Of course, now that everything is opened up, there is a chance that the disease will flare up. Probably that's happening right across the country. Now the mandate both from the state government and the university and the central government is that every medical college should have the capacity to do testing. While they started, they said only testing can be done by National Virology Lab Pune and their subunits which were there, and one of the subunits was in Bangalore. Even NIMANS, which had the capacity, was not doing the testing.
Okay.
But they realized that they need to ramp up the testing, and they've done a fairly good job, and they have accredited labs and checked their quality control. They've done it remotely through Zoom. So St. John's was actually certified. So they really made a great effort to try and get more and more hospitals, and both in the public sector and the private sector, to be able to do testing.
Right.
And they have used the private sector to do the testing. The other thing they have realized, so that they could increase the number, is to do what is called batch testing. So if you have got, particularly when you're doing this contact tracing, see, you may not have symptoms, okay, but you might have come into contact with someone who has the disease.
Right.
So I'm not bothered about knowing whether people like you have, but I want to know if any of you has got, any of you has got the infection.
Right.
So if you have not picked up the infection, I need to know so that you can take the precautions, you
To
don't
avoid
come,
the
to avoid.
contacts.
So I bunch 5 people like that and I do the test. So if it is negative, then all 5 of you are negative.
Right.
But if you are positive, then I need to check all 5. So that way also they have ramped up the testing. I think the whole of Victoria Hospital has been earmarked only for COVID patients.
Right.
And the whole of Bowring Hospital has been earmarked only for COVID suspects. Okay, and I think Jayanagar General Hospital also. And now they have been, and all, like what I said for St. John's, is an expectation of all medical college hospitals. It is not only St. John's.
Right.
Right? So I think at the moment, even if there is a surge, I think we should be able to handle it. Okay. No
Yeah.
problem. So hand washing is probably
The
most important.
crucial step.
Mask will help to some extent, or something like that.
Right.
So you immediately go to the person. It also, the thing is, there is a phase of the disease where you may be sick and you may not realize it. When I'm talking of sick means very sick
Where
and
you have
not.
the infection?
No,
but
no,
you-
not only infection. You have infection and you have severe consequences of the infection, but you may not realize.
Okay.
Because in the initial stages, breathlessness may not manifest itself, but the oxygen saturation may fall down.
What do you mean by oxygen saturation?
Your oxygen levels.
Right. That is something that you cannot tell outwardly, but
Normally, both go hand in hand.
Okay.
But at a certain phase of the disease, some people may have oxygen which is low, but they don't feel very uncomfortable. No. They don't feel so uncomfortable breathing.
Okay.
Normally, when my oxygen low, I'll have some reason for also feeling uncomfortable
Right.
to breathe.
Right.
This doesn't happen.
That's because of the virus.
That's because of the
Nature of the
nature of the pathology due to the virus.
Right.
Not because the virus is causing a multiple thing. So that might happen. So from that perspective, but I don't think there is any myth or. I think the disease, from whatever I can see, in terms of if you look at the statistics, see roughly what is said, 80% will be asymptomatic or mild.
Right.
Worldwide.
Yeah.
That's what is about 15% will require hospitalization.
I also spoke with Mr. Kapil Mohan, the Principal Secretary for Infrastructure Development to the State Government of Karnataka. Mr. Mohan was also the COVID Secretary of Kalaburagi or Gulbarga, where from the first COVID death in India was reported in March 2020.
A state executive committee was formed, which was headed by the chief secretary, and that assumes quite a lot of powers which are given in the Disaster Management Act.
Right.
And that is actually to be read with the Epidemics Act. That was formed, and along with that, 15 subcommittees were formed, which were chaired by different officers, which would take care of the various aspects of COVID-19 preparedness and response. Enforcing of the lockdown was dealing with its aftermath and also preparing the state's medical facilities for the expected rise in the cases, both in terms of monitoring as well as curing. So those plans were drawn up for all the state district wise, and then as the events unfolded, additional responsibilities like movement of migrant labor, outgoing, incoming, all those were designed and planned. While dealing with the challenge of the COVID-19, one was not only identification at an early stage of a person who has been affected by the COVID. That was a critical factor on two counts. One was the sooner the person enters into the formal medical system, their chances of survival would be higher. And B, the sooner they are identified, the number of people they would be infecting would be much lower. So a contact tracing was done. I mean, a person who has contracted COVID and he was found to be positive of that, we would see whom he had been in touch with, in the past 15 days, and utilizing various primary and secondary. Primary being ask the person as to what he has done, and secondary being trace his movements according to the call records, where he has been, and then finding primary and secondary contacts. Now, those would constitute our main target of whom we would watch and test, because there's a much higher chances of their getting infected by the COVID-19. Now, actually, the implementation of that was a very critical thing, and there was a lot of learning going on, and this was jointly done by the police and district administration authorities. Structure for this, and under the National Disaster Management Act, a state executive committee was formed, which was headed by the chief secretary, and that assumes quite a lot of powers which are given in the Disaster Management Act. And that is actually to be read with the Epidemics Act. That was formed, and along with that, 15 subcommittees were formed, which were chaired by different officers, which would take care of the various aspects of COVID-19 preparedness and response. Then B, immediately after enforcing of the lockdown, was dealing with its aftermath and also preparing the state's medical facilities. So those plans were drawn up for all the state district wise, and then as the events unfolded, additional responsibilities like movement of migrant labor, outgoing, incoming, all those were designed and planned. While dealing with the challenge of the COVID-19, one was not only identification at an early stage of a
Right.
person who has been affected by the COVID. That was a critical factor on two counts. One was the sooner the person enters into the formal medical system, their chances of survival would be higher.
Right.
And B, the sooner they are identified, the number of people they would be infecting would be much lower.
Hmm.
So, a contact tracing was done. I mean, a person who has contracted COVID and he was found to be positive of that,
Hmm.
we would see whom he had been in touch with. Now, actually, the implementation of that has to be was a very critical thing, and there was a lot of learning going on, and
Right.
this was jointly done by the police and district administration authorities. So, in the whole COVID response, technology has played a key role.
Right.
One, of course, has been usage of technology for very effective contact tracing.
Hmm.
As I told you that you use towers, location of the person through their mobile phones and this thing. I mean, to say that it was a sum total of information and communication technologies
Right.
uh, that has helped us a lot. And then, of course, later on, we developed apps which helped us to deal with the large numbers which were generated, uh, not only on COVID identification, COVID treating, or migrant, I mean, consequent movement of people or monitoring the movement of the people. Also, related stuff like logistics, movement of essential commodities. So,
Right.
on all that, the use of technology through apps for contact tracing, using of ICT technologies for contact tracing, Seva Sindhu app and Aptamitra app, and now Government of India has also have another app. So all those apps have helped us to uh, contact trace very quickly and then monitor their status.
Finally, I spoke with RJ Jimmy, who hosts a wildly popular breakfast radio show in the city on Mirchi 95 FM. Along with his mother, Jimmy was part of an early crop of cases detected in the city. He has now completely recovered and speaks glowingly about the city's and government hospitals' quick response to the illness outbreak.
Hi, I'm feeling fine now. In fact, I was fine for the most part because I only had a fever, a slight body ache, and a cold and some sneezing. That's it. Those were my only symptoms. Yeah, I'm fine, and I was fine actually even before I reached the hospital. The reason I went for testing was because my mom tested positive for COVID, and as per the rules, every primary contact had to get tested. The thing is that when my mom went in, the next day I started getting the symptoms. So I had a fever, and it was between 99 to 100, and I kept it under control with paracetamol because I couldn't go in for testing until the BBMP officials called me. So yeah, I'm perfectly fine now. I've been fine for a very long time, in fact. The process of getting tested was actually quite simple. The officials came and they told me that we need to go in. They told us to pack for 14 days because we'd be out for a minimum of 14 days, and that's what they told us. And the testing process also was very simple, actually. Very well, neatly done at the Rajiv Gandhi Institute of Chest Diseases here. And that bill you have to foot. So we got in touch with the government and asked them, will this bill be footed? And they said, no, you're at a private hospital and you'll have to foot the bill yourself. So depending on the kind of, let's see, the care that you need. So in case it's critical care, then that means ventilator, ICU, you pay those charges for how many ever days you are and what the hospital generally charges for that. The hospital staff were amazing at Victoria Hospital. I mean, they were so good. See, I went in at a time where things were still very uncertain. Protocols were still being changed every day. Medication was being changed, the medication protocol. But they were there in their PPEs, personal protection equipments, covered from head to toe. Okay, so once they wear their equipment, they are not allowed to remove it for 6 hours, and they have to stay in it. So no eating, no drinking, no going to the toilet, and they're sweating inside, but you can't do anything about it. In spite of that, they were so friendly, so empathetic, so caring. There is no need to panic. It is important to be cautious, but there is absolutely no need to panic. Karnataka has done a fabulous job. Actually, the BBMP have done a fabulous job in Bangalore. Some people thought they were overzealous, but they did a very good job of swooping in when they found a case and sealing the area off, containing it. So they've done a very, very good job. A big shout out to the BBMP in Bangalore for the work that they've done. Don't panic. Don't panic, but be cautious and do the things that they've asked us to do, which is social distancing, wearing a mask, sanitizing your hands ever so often, especially when you come in touch with common surfaces. You feel like you've got a cold or you've got a fever and you're like, oh my god, is it the virus? Should I go get tested? First thing is, don't run away to a testing center to get tested. They will not test you unless you qualify for testing. The first thing to do is to download the app, the Aptamitra app, and to do a self-test. And then, depending on that, call the helpline. They will tell you what to do. If you need to be treated, they will direct you to which center to go and get treated. So don't run away to a testing center at the first sign of a fever. A fever is not a sign of the virus. It is just one of the symptoms. Okay? So take care and chill.
As the rainy season sets upon Bengaluru, many influenza like illnesses have emerged as COVID positive cases in the city. Influenza like illnesses affect a person's immunity, making them more vulnerable to contracting the coronavirus. In the coming days, the Bengaluru municipality is expected to test more aggressively than ever to keep the numbers in the city under check.